Here we are at the TBSE meeting, and I have Jeremiah with us. Jeremiah, introduce yourself and let everybody know where you practice. And if there are dentists watching, that have never used the KoR system, having used it yourself for quite a while, what would you tell them?
I would tell them that it is super easy, and the patients they love it.
Good.
It's amazing at the results that you're going to get. I practice in Athens, Alabama, and I'm the only one in the area that uses the KoR system.
Okay.
And so we have patients that'll drive an hour and a half to come.
Now, that's a good thing. Patients, how are your patients reacting?
Especially the patients that are tetracycline stained or just deep coffee stains or whatever. Generally they'll get up and we'll show them the results, and typically you'll see a tear or two come to their eyes.
That's great. Now, a great question I love to ask. To me, the staff is so important. Because if your staff is behind something, it's going. I mean, it's going to rock and roll. Now, don't use any brand names or anything like that. But compared to other systems you've used before, and the results that you're getting now, what has your staff's reaction been as far as their motivation?
Well, I actually use your system and two others in the office.
Okay.
And when we go to talk to the patients about it, it's always the KoR systems first. Because the staff they see the crazy results that you get out of it.
Uh-huh.
So we try to push it to the patient first.
Right.
If they're awful looking,
Okay.
But they cannot believe it. The first patient we did, her teeth were almost black, and when she left, she was in A2, A1 shade.
Wow.
And so, crazy.
Wow. And of course now, I think as I was telling you before, because of the new changes in the system, we've been able to bring down the cost and the time involvement. So the nice thing is now nobody has to reserve our system for only the tough cases.
Correct.
Because you basically, we have anywhere from just at-home products. So if you have patients that they only want to do at home, or if you want to do in office and at home, now that we're totally price competitive and time, the amount of time that's spent, now we're excited that offices are going to be able to use our system for everybody and get our kind of results and have it take the same amount of time and the same amount of cost.
Right.
So
right.
Great.
That'll be a good
Anyway,
thing.
thank you very much. I appreciate it. Enjoy the meeting.
Yes, sir. Thank you.
Right. Bye.